My own journey to this podium is grounded in my experiences as a lifelong resident of Dubuque. Both my parents grew up in Dubuque. After serving in the Navy, my dad started out working on the line at a family-owned business, the Dubuque Packing Company. He eventually worked his way up to be a vice president of that company. My mother managed our household and guided 6 children to successful adulthood. In her spare time, she volunteered to help prepare and serve the hot breakfast and lunch programs at our neighborhood school. My parents brought their children up to be involved in our community and to give something back in return for all that's been given to us. There was one other group of people who also influenced me. As you may know, Dubuque area is home for 5 women religious orders. The good sisters instilled a passion for justice in me. They taught with their words and actions that all persons are created equal. And they taught us that to fail to speak up and do what's right is to fail to do our duty as a citizen. Democracy, equality, justice were not just words we learned in school. The sisters taught us they were ideals that we should seek to advance in our personal and our public lives. Years later, as a young mother, I encountered discrimination that brought that passion for justice to life. At the time, Area Residential Care, a local group that helped adults with intellectual disabilities, hoped to build a group home in an upscale Dubuque neighborhood. One particular individual was quite vocal in his opposition to the home. In fact, he said he didn't like the way they looked. He worried their presence would lower property values. Despite the opposition, the City Council granted the building permit, and today there are some 24 similar group homes in Dubuque. Adults with intellectual disabilities and their families are more integrated into our community than ever before, and Dubuque is more beautiful and a better place to live because of it. That was my first experience with discrimination that my daughter Sarah faced simply for being who she is. It convinced me to run for public office. So in 1992, I became the first woman to represent the city of Dubuque in the Iowa legislature. I arrived in Des Moines ready to pass legislation to improve the lives of Iowa families and make our state more prosperous. I'm sure many of you walked into the State House today with the same goals. However, my ambitious plans collided with a very harsh political reality. As a Democratic member of the Iowa House, I would spend the next 14 years in the minority. Pat Ward, our former colleague, knew how to accomplish things for Iowans even while in the minority. With patience, persistent goodwill, and hard work, Pat helped improve the lives of Iowans. In the last few years, I was honored to work with her to give young people involved in our juvenile justice system a second chance. Pat knew how to put good government ahead of good politics, and we all miss her. Today, Iowa is one of only 3 states with a divided legislature. To be successful, we must all work together. The troubling questions confronting us do not have a Democratic answer or a Republican answer or an urban answer or a rural answer. They can only have human answers, for they are the questions that ask, what kind of life do we want to live together? One of those troubling questions is how to ease the serious health care worries many Iowa families have today. Fortunately, on this important issue, legislators from both parties have already listened to Iowans and already worked together successfully. Several nonpartisan healthcare commissions made up of healthcare providers, insurers, business advocates, and consumers have pointed us in the right direction. Former Democratic Governor Tom Vilsack and then former Governor Terry Branstad co-chaired one of those commissions. That bipartisan effort is why today Iowa's children are now among the healthiest in the nation. The result was working together to expand Hawkeye, the Healthy and Well Kids of Iowa insurance program. Today, Iowa is well positioned. Today, Iowa is well positioned to lead the nation in solving tough healthcare problems for families and businesses alike. We can do it by showing the nation how to put lasting progress ahead of short-term partisanship. This session, let's continue our bipartisan effort to improve mental health services across the state. This session, let's keep investing in the services that allow our older citizens to stay in their own home. And here's the biggest opportunity for this session: to make a positive difference for Iowans. Right now, too many families risk the loss of their home and bankruptcy if a parent or spouse or child becomes ill. Right now, our local hospitals and healthcare providers are burdened with roughly $1 billion each year in uncompensated care. Right now, that uncompensated care drives up insurance costs for every Iowa business and every family with health insurance. We can fix this problem, and we can do it right now. Last month, I listened to Iowa's healthcare leaders from across the state. The people who know Iowa healthcare issue best are speaking with one voice. They are urging us to expand Medicaid. They point out that expanding Medicaid will make affordable health insurance available to all Iowans. Expanding Medicaid will make Iowa's healthcare system financially secure, and expanding Medicaid will slow rising healthcare costs for Iowa's families and Iowa's businesses. By expanding Medicaid, we will bring health insurance to 80,000 currently uninsured Iowans and preserve health care for 70,000 currently on Iowa Care. Iowans look at the mess divided government in Washington, D.C. has produced, and they shake their heads. Iowans expect better from their state legislature, and we have delivered in previous sessions. Early in this session, let's show Iowans that rather than engaging in senseless partisanship, we will again listen to them and do what's right. I strongly encourage you to talk with hospitals, nursing homes, doctors, and other health providers in your districts. I did, and I'm convinced that expanding affordable health insurance is one of the best things we can do for Iowa families and to help grow the Iowa economy. When our children and grandchildren look back, I hope they will remember this session is one in which Iowa's common sense and Iowa's sense of community rose up to meet the challenge of our times. At the close of the convention that drafted the United States Constitution, Ben Franklin asked this question: is it a rising or a setting sun? Each generation since 1787 has answered that question. Now, the answer rests with us. Thank you.